If you think about it, I didn't have to be Genie. I'm saying I have this anxiety when I have to be Genie.
Hello, and welcome to the Dr. Suzette Glasner podcast. Thank you to all of you who have been liking my videos and subscribing to my YouTube channel. If you haven't already done so, please do subscribe to the channel so that I can continue to bring you content on mental health and addiction. So today, I'm going to be talking about my favorite mental health podcast, State of Mind, hosted by Maurice Benard, and the most recent episode in which he interviewed the legendary actress Genie Francis, who has played Laura on General Hospital for decades. In that two-part interview, in part one, she spoke very candidly about a topic that I think does not get enough airtime in our field, which is social anxiety. And I feel like we can learn a lot from Genie about this topic, about what it is and how people experience it and what are some of the ways through it. First of all, I'm sure as an audience member, many of us were thinking, how could that be that Genie Francis has social anxiety? She's up in front of millions of people acting and playing her part as Laura. She's not anxious. She doesn't appear anxious. And even in the interview with Maurice Benard, she carried herself so beautifully. That gets to a little bit about the question of what is social anxiety. Because to me, as a clinical psychologist, it made a lot of sense that being on stage was a way in which her anxiety could be masked much of the time. And it's an intense fear of being evaluated and judged in social situations specifically. So people are going to see who you are or how you are, and they're going to disapprove of you in some way, or they're going to see maybe some flaws that you have that you feel self-conscious about. They're not going to accept you or think that you're any good, or even more commonly, they're going to pick up on the fact that you are showing signs of anxiety when you're talking to them. And that's going to lead you to feel really embarrassed or even humiliated. That's the core of what it is to experience social anxiety. And in some ways, having a character to play like Laura is a way of taking cover from it, because you're not really having to be you, which is protective against feeling anxious about people seeing who you are and judging you.
If you think about it, I didn't have to be Genie. I'm saying I have this anxiety when I have to be Genie. When I have to be Laura or any other part I'm playing, I'm absolutely fine.
Yeah.
So for Genie, the acting career has been the perfect fit in so many ways, not only because she's a legendary talent, but also because it's really been an antidote to social anxiety for her, spending so much of her time as she does on a stage being somebody else. And in some ways, even though that has protected her from having to be Genie around other people and the anxiety that brings about, that's also made it easier for her to avoid social situations. This brings a second and really important point to understand and help yourself or a loved one with anxiety, which is that avoidance makes anxiety worse. So Genie and Maurice touched on this in their conversation when she talks about how social her husband has always been and the dynamic that created in their relationship as far as his desire to socialize and bring her along for that.
And he used to make me go to like all these events. And I'd be like,
But that's the way you do help that.
Is to make yourself go.
Yeah.
So Maurice is right. The treatment for social anxiety is exposure. Let's talk a little bit about why that is and what exposure looks like. First of all, when there's something we're anxious about, whether it's social situations or whether it's driving on the freeway or whether it's being in enclosed spaces, like for people who are claustrophobic, when there's something that makes us anxious, when we actively avoid it or run away from it, our brain learns something. Our brain learns that staying away from that thing, whatever it is, whether it's people, social situations, staying away from those things is what's keeping us safe. That's what it feels like. It's not rational because we're not really in danger when we socialize, even if it makes us nervous. We're not really in danger when we're in an elevator, even though it makes us uncomfortable. We're not really in danger in a supermarket, even if we get anxious when we're in more crowded spaces, like Genie talked about her mother getting very anxious in supermarkets. But when we respond to a situation like that makes us anxious by escaping it, running running away or avoiding it, what we teach ourselves and what we reinforce and ingrain in our minds is that the reason I'm okay is because I didn't go do that thing. I didn't go into that social situation. I'm okay. I'm safe. So the more you repeat that avoidance behavior, the more you strengthen that connection in your mind that says avoidance equals safety. Avoidance equals safety. But unfortunately, the way anxiety works is that it keeps on creeping up and it gets worse and worse in those situations that we avoid. So that seeking of safety and escape from it actually reinforces a lot of the irrational beliefs we have about the fact that we can't go certain places and we can't do certain things because it's going to make us suffer, it's going to make us anxious. And even though a lot of us don't often complete what that entire thought is, it's usually something along the lines of, and I can't deal with that, or, and I'll go crazy, or I'll faint, or I'll lose my mind, which is also very irrational, but it's what anxious minds do, and it's what they tell us until we teach ourselves something different, which is that, and this is what Maurice and Genie were talking about as far as exposing oneself to those situations. So if you expose yourself to that situation and you stay in it and you stay with the anxiety, you learn that anxiety comes and it goes. It doesn't stay there forever. You learn that anxiety doesn't kill you or do anything horrible to you. It's just very uncomfortable. And the more confidence you build up that you can cope with a situation that evokes anxiety for you, the less power the anxiety has over you, because you recognize, okay, the worst thing that's going to happen is I'm going to feel anxious, but that too will pass. Right? Of course, I'm making it sound very simple, and it's not that simple, because when you have very severe anxiety, it's super uncomfortable and it's very scary and it feels like something horrible is happening to you. So this is not to discount that at all, but this is just to help you understand a little bit about how exposure therapy works. Simply exposing yourself to a situation that makes you anxious without any tools for coping with that anxiety is not going to be super helpful either. So this is one of the reasons why, whether you get the sort of guidance from a self-help book or from a therapist or a mental health professional, it is important to go into these sort of exposure situations with some tools that you can use to deal with the anxiety when you're in that situation. Of course, you could just suffer through it, but if it was that easy, you wouldn't be avoiding these situations to begin with. Just a couple of things to keep in mind if you really want to overcome social anxiety, panic attacks. Exposure is the way, but ideally with some guidance from a mental health professional who can help you have some skills in that situation for what's the inner dialogue I'm going to have in this situation? What am I going to tell myself to get through it? One of the worst things you can do, which Genie ended up reflecting on when she spoke a little bit about her mother, is to bolt from the situation when you're feeling anxious, because you're reinforcing that idea that you only became safe because you bolted, right? But in reality, it's very hard to stay in these situations, because not only are you experiencing these anxieties around being self-conscious in a social situation, if we're talking about social anxiety, but that's accompanied by a lot of really uncomfortable symptoms. When it's social anxiety, you start blushing, you can start shaking, you can get a pit in your stomach and feel nauseous. It's like a very physiologically very uncomfortable situation. And then that also fuels those feelings of self-consciousness, like everybody can tell that I'm so anxious, and that makes the anxiety more severe. So you really do need some tools to enable you to cope with this if you're going to practice exposure. But the general principle that exposure is the way through anxiety has proven out in studies time and again. And also, of course, through my clinical experience working with people who are trying to find their way through anxieties. The third point that Genie made in her discussion is about the genetics behind anxiety.
When I first realized that I had something that was not just my tendency or my personality, but something that was, first of all, I realized it ran in my family.
So after she talks about having recognized some of these connections with anxiety throughout her family, she then describes these panic attacks that her mom used to have in the supermarket. And she learned later that her great-grandmother also had social anxieties. Her observations are very well aligned to what we understand from genetic studies, which is that 30 to 50% of the risk of having an anxiety disorder, whether that's social anxiety or panic disorder, is influenced by genetics. And there's a lot of overlap between the different types of anxiety. Genie describes her mom's struggle with what sounds like panic disorder, where she would leave the grocery store due to anxiety. And the difference between social anxiety and panic disorder is that panic disorder is when you have repeated panic attacks in various places. So it can be triggered by a lot of different things. And often over time, it becomes triggered by the very situations where it comes up, because it comes up out of the blue. Suddenly you feel panicky and anxious and you don't know why. But wherever you are, in whatever situation you're in, that becomes associated in your mind with panic attacks. So if that happens to happen when you're in the grocery store, or if that happens to happen when you're in the car, you start to associate those places and experiences with panic. And then it can become a little bit of a vicious cycle where just being in that place can trigger anxiety attack. So that's panic disorder. And then ultimately what makes it a disorder is that you are wanting to avoid those places because the anxiety feels so unmanageable and intolerable. And that, if it's not treated, can turn into what we call agoraphobia, because you're starting to avoid so many different places that you associate with anxiety that the only place that feels safe really is home. That is totally treatable, just by the way. So if you're in that place where you're starting to avoid places or you're wanting to be home a lot, just know that there are very effective treatments. And if you consult a mental health professional, you can get to the other side of that. Social anxiety, on the other hand, is where those panicky, anxious feelings are tied specifically to social situations and is predictably frequent for you whenever you're dealing with other people or in front of other people, or a range of situations involving socializing with and being around other people and needing to be yourself. So in addition to that genetic vulnerability explaining 30 to 50% of this, there are also environmental factors that we understand from research to play a role. Adverse experiences in childhood, trauma, those are all contributors. Other contributors are parents or immediate relatives with anxiety, and sort of observing that. We do have this experience of like observational learning from our parents and our relatives. So it's not to blame anyone's parents for their anxiety, but that sort of passes through to kids genetically, but it also can pass through their observation of a parent being anxious and how they manage that. That could just influence their vulnerability. And finally, the last point I want to make is about the importance of letting go of shame about anxiety. There's something Genie said towards the end of the conversation on this topic that really struck me.
And if I searched through all of the family, I'm sure I'd find more sufferers, and I know it's in me. The good thing about knowing that is that it gives me a little bit more forgiveness for myself.
So for any of you who experience social anxiety, you need to know that it is largely genetic. And of all the anxiety disorders, it is the most common and the third most common psychiatric disorder behind depression and alcohol use disorders. So the point being that you're really not alone with this. I'm so glad that Genie was able to alleviate some of the guilt and shame that she experienced by understanding this as a family illness or an illness that affected much of her family. So she was able to process that, okay, this has something to do with genetics. This isn't my fault. But really, there's no shame in it to begin with. We're all born with something, whether it's a physical malady, whether it's a mental health struggle. We know that around 1 in 4 people have some type of mental health issue. There are some mental health issues that are what we call subclinical. A large proportion of the population has had a panic attack ever in their life. Does it progress to and become panic disorder for all of those people? No. But if you look around you, most everyone has struggled with mental health issues either in themselves or in their family, and there's really no shame in it, and it's really not something that is under our immediate control, because so much of it is indeed genetically influenced, and it's also environmentally influenced, which we can't always control what's happening in our environment. It's also trauma influence, which we can't necessarily control. Most of the time we can't, whether we're exposed to trauma as young people. We're all contending with something. Some people are more open about talking about what it is that their struggle in life is than others, but everyone is contending with something. And so what really matters at the end of the day is how you manage it, how you understand it, and how you find a way forward to living a meaningful life despite it. Thank you for joining me today. I hope you learned something valuable, and I look forward to seeing you next time.